my name is Moby Parsons, and I'm an orthopedic surgeon at the Knee, Hip, and Shoulder Center in Portsmouth, New Hampshire. We are a focused practice that specializes in rapid recovery after knee, hip, and shoulder replacements, and we are New England's leaders in outpatient joint replacement surgery. I'm going to introduce you today to our AVATAR program, which is a perioperative care plan designed to accelerate and improve outcomes. This program was pioneered by my partner, Dr. Thomas King, and has been perfected over several years and over 1,000 combined outpatient joint replacement surgeries at our center. Please visit our website and our blog to learn more about this program and the other services that we offer. AVATAR is an acronym that stands for Alignment of Vital Assets to Accelerate Recovery. Inherent in this concept is that the care is designed around the patient and not around the providers. All services are coordinated and navigated around the patient's needs and with the goal of ensuring the best possible outcomes. At the Knee, Hip, and Shoulder Center, we are very selective about the other providers we work with who understand our expectations and can provide a level of customized service that we think is essential for an optimal recovery. In many centers today, too much emphasis is placed on the surgery itself and not enough on the other essential ingredients of the perioperative and postoperative process. Care is often fragmented and not patient-centered. AVATAR places equal emphasis on all the critical parts of the process, putting them together through a carefully navigated plan. Like a good recipe, each ingredient is essential to the finished product. So what are the vital assets that can help activate patients to achieve greater outcomes? Patient education is really the blockbuster drug of the century. A well-educated patient who understands the process and expectations is proven to have better outcomes. Health and nutrition optimization are also very important for boosting immunity and improving healing. Using the best implants and surgical techniques to reduce tissue trauma and ensure long-term durability of function. We use a multimodal pain management approach, and this is a combination of medications that work synergistically to reduce pain by blocking different pain pathways. This allows patients to use far fewer narcotics to achieve sufficient pain control, avoiding the side effects that can occur with prolonged opioid use. We also take steps to minimize the surgical stress response by crafting a care pathway that focuses on those elements that can improve healing and recovery. Immediate mobilization is also critical to prevent stiffness and swelling. We use selected physical therapists who can provide the level of concierge service that we expect for our patients. And finally, seamless communication with our patients, visiting nurses, and therapists. This allows us to make sure that nothing falls through the cracks and to head off any problems before they could potentially become complications. As I mentioned, the AVATAR program allows a majority of our patients to go home the same day, just several hours after their surgery. Patients with private insurance can undergo these procedures at one of our ambulatory surgery centers, and patients with Medicare can undergo same-day surgery at Portsmouth Regional Hospital. Our practice has performed more outpatient total joints than any other in New England, and this has proven not only safe, but also highly satisfying for patients. Many people may be surprised about the idea of same-day joint replacement, but this is really a growing trend, and it has proven to be safe and reliable in large studies. It makes a lot of sense when you consider that hospitals are really for sick people. They're noisy, impersonal, uncomfortable, and full of dangerous germs. They're also very expensive. Patients don't sleep well in hospitals, and pain control is often made difficult by the fact that nurses have to retrieve medications from the pharmacy, which can lead to delays in patient care. What makes our program successful is a concierge level of service and excellent communication between our care team, our select providers, and our patients. We call this process navigation, and this is what really sets us apart from other practices that focus more on the surgical experience rather than the entire recipe of care. AVATAR is really different, and it's our commitment to our patients to achieve the best outcomes possible. The formal definition of avatar is the embodiment of a concept. And while it serves as an acronym for the key elements of a successful joint replacement, according to our rapid recovery program, we really like to think of avatar is who you will be after your arthritic pain is gone and when joint replacement can restore not just your mobility, but overall better living and quality of life. What will you get back to once your pain is gone? Once again, Avatar is an individualized custom care plan to maximize your potential. It's a care process with navigation so that nothing falls through the cracks and a dedicated team focused on your best outcome. Thank you.